Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
I've seen lots of different alternative care practitioners. Nobody called it out about migraine. Nobody. So I finally got a neurologist. We had a telehealth appointment and she showed up and she was like, the first thing that I just want to say to you is, how did you get to be 45 and nobody said this to you?
Welcome to this episode of Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Sarah Shaw, Associate Director of Diversity, Equity and Inclusion and Community Outreach at the Global Healthy Living Foundation. I have been living with chronic migraine for almost 10 years, and I'm very open about navigating life with my chronic disease journey, as well as my experience living with anxiety. This podcast will be a window into other patients' lives as they navigate their own journeys living with chronic pain, migraine, and mental health. Today, we're joined by Katrina, a migraine patient that we're really excited to have on the podcast. Hi, Katrina. How are you doing today?
I'm hanging in there. How are you?
You know, hanging in there is about the type of field that I think we're going for today. Just happy to have you on the podcast.
Yeah, thank you for having me.
Yeah, no problem. So let's jump into it. If you could have one word to kind of describe your migraine attacks, what would it be?
Oh my gosh. Awful?
Yeah, we're laughing, but I'm laughing in solidarity and pain as I think anyone who deals with head pain or any sort of headache disorder, migraine, cluster, awful is a pretty good word. I think this leads me into my next question. There's a really big misconception out there about migraine being simply just a bad headache, which obviously, being from the migraine community, we all know that is a lot more complicated than that. Thinking about that, can you walk me through one of your worst migraine attacks? What is that like to help listeners see?
Yeah, I super appreciate this question because I think for a long time I was one of those people that didn't understand that potentially I had migraine. So it often starts for me with yawning, lots of yawning. And that's a clue for me now that something's coming. I also start to get like the fancy name is allodynia, but like your skin just hurts. So if I notice those two things happening, I'm like, okay, let's get ready. And then if I don't or can't do anything to prevent it at that moment, it will progress into a headache, just what has felt like a headache for all my life. And then it will progress into different types of pain that are kind of hard to explain from the outside, but I can just tell the difference between like a tension headache and a migraine.
Right.
Often it's behind my right eye or like right above my right eye. That's the spot.
It's the ticket, unfortunately.
That's the ticket. And then if it's going to be like top level, terrible attack, I will start to get horrible nausea. I will get really sensitive to light and sound. It'll be hard to just do things. It'll be like where I just want to go lay down in a dark room until it can pass. And a lot of the time, it will be that I just need to sleep it off. So a lot of the time, if I'm going to have an attack, it'll last for most of the day until I go to sleep. And then usually sleeping will help. That's how I operated for a lot of my life until I finally got a neurologist. And then now I have a preventative and I have an acute medication that I can take to help it not progress to those levels. And I don't know about you, but I play that game. Oh, is this going to be a migraine attack or not? Do I need to take my medicine or not? I don't know. You only get 10 at a time of the one that I get. And so, yeah, I play that game with myself a lot.
Thanks for breaking that down for us. I know that from talking with you back and forth, you had a sort of unconventional way of getting diagnosed with migraine. And I think you mentioned that started with you getting diagnosed with endometriosis and then realizing that you could advocate on multiple levels. Can you share a little bit with our listeners about what that journey was like for you, starting from multiple primary care physicians over the years and not being misdiagnosed or not diagnosed at all?
Yeah, so I have multiple conditions that I know were missed by primary care doctors for quite a while. So the first one that kind of reared its head was endometriosis, and I was dealing with that since I was young in my early 20s. And with that, it was just that the gynecologist would say, oh yeah, this is just a bad period, which it's like the same thing that migraine patients hear about. It's just a bad headache. So that took 10 years for diagnosis. And then I have seen so many doctors. I've seen naturopaths. I've seen just typical allopathic doctors. I've seen lots of different alternative care practitioners. Nobody called it out about migraine. Nobody. And as I started to become more of an endometriosis advocate and just be in the healthcare space more, and I started to follow a bunch of patient advocates on different socials, I learned so many things. And I realized the list of symptoms. I was like, this really sounds a lot like migraine. Let me figure this out. Also, my mom struggled with it for a long time. So it was always in the back of my mind that this could be something that would come my way. So I finally got a neurologist in April 2022, and she was incredulous. We had a telehealth appointment and she showed up and she was like, the first thing that I just want to say to you is, how did you get to be 45 and nobody said this to you?
Oh my gosh.
I had to fill out a massive intake. It was like pages, pages, pages,
Right.
pages. She was like, I don't know how anyone missed this. So let me just say right off the bat, you have migraine
Wow.
and we're going to get you on a treatment plan.
How did that feel for you?
Well, it wasn't the first time that I kind of knew that something was up and I suspected what it was. And then it was turned out to be that I was right. So I guess validating in some ways, infuriating in other ways that all of these doctors before missed it.
Yeah.
But knowing that there was going to be some help, because when I saw that doctor, I was up to 15 or so days a month. And I didn't even really realize that that was pushing me toward chronic migraine. Like the line was pretty close there, and that potentially it could have gotten a lot worse had I not gotten that help. So that was at a time when I moved from Vermont to Colorado. So that was the only time I could see that neurologist, and I had to find a new neurologist to kind of continue my care. But she helped me both with some kind of daily things that I can do, like drinking electrolytes, paying attention to the signs and all of that stuff. And
Right.
I learned a lot more about what my triggers are also after that diagnosis. Now I'm on a preventative and I'm on an acute triptan if I notice something happening. So there are ways that I've gotten my life back because the attacks are not so bad because I can manage them better now. And I'm down to like the most is like 3 in a month. So it's a lot different.
That's huge. I can relate to a lot of with what you're saying in terms of not as severe as you in terms of 45 and the finally someone is validating your experience of what you've been living with, where I'm sure part of those thoughts were it must be all in my head because none of these doctors are catching it, and to be going through so many and to be in so much pain but not have any relief from it must have been incredibly infuriating and painful and frustrating. And you have this aha moment with this doctor who took the time to diagnose you but also help you feel better and help you get to being better. And I know we also call that in terms of working with your doctor and shared decision making and having conversations about what will work. And you mentioned that you learned a lot about your triggers too, which obviously we can't avoid all triggers in life, but there are certain things that we can tend to stay away from if we know that it's something that's going to give us a big, bad, angry migraine attack. You mentioned that you kind of fell into endometriosis advocacy, and I've been living with endo for probably about since I was, 14, 15, right around when my cycle first started. And it's one of those conditions that is also, like you said, severely undiagnosed. And I'm just curious what you've learned from the endo community that you've taken into your migraine advocacy.
I mean, really, it was the endo advocacy that led to me advocating in all other areas. I'll try to make the story as short as I can because it's kind of epic. But basically, in my late 20s is when I was diagnosed. I was having a pain that I ignored for like a year or more. Like it just kept getting worse. And I was so scared it was cancer that I was like, I can't deal. I don't want to know.
That's a real fear.
I was also scared of surgery. I'd never had a surgery. So I was like, I can't have surgery. I can't have cancer. I'm just going to ignore it. Maybe it'll go away. Well, it did not go away. And it got so bad that I couldn't even really buckle my seatbelt without it hurting. Like that's where I was. And I was just like dealing.
Oh my gosh.
Well, I finally went to the gynecologist and they found a giant cyst in my ovary. And the doctor completely scared me and was like, we have to operate now. like, this needs to go. I had never heard of the word endometriosis before that. I didn't know about ovarian cysts, nothing. Anyway, I had an ablation that time because I knew nothing, right? This was a long time ago. Sure enough, it was an endometrioma, which, if anyone knows, endometriomas can be very, very persistent. It's like a blood-filled cyst that grows on your ovary. And I just am a champion at growing them. So within 3 months, it came back. The same pain. And I was like, no, this is not happening. I went to a different gynecologist because I didn't like that gynecologist. The exact same thing happened. She was like, let's get you in, ablation. And then she wanted to put me on the pill. But historically, the pill has been a disaster for me. I do not tolerate it. So I tried to go back on the pill and I lasted 3 days, but I have heart issues that happen when I'm on the pill. So I stopped. I had 10 years of relative okayness. And I guess maybe just back to like baseline pain that you can have with endo when you have your cycle. And then things started to get way worse again. And in 2020, I had to have surgery again. But this time I had done my research and I had gone looking for information. And I found out about Nancy's Nook on Facebook, and I found out about other endo advocates and just learned a lot. And I decided to look in Vermont to see if there was someone who could do excision. Vermont can be a tricky place for healthcare because it's just smaller and there's not as many like high level doctors there. But I was lucky enough to find a very compassionate, very good doctor in Vermont who listened to all my concerns. I had been diagnosed earlier that year with mast cell activation syndrome. So I was not sure how that would affect surgery. And she was very good about helping me through that. And so I had my first excision and I did well for about 6 months. And then I started to lose my mobility and I was not able to walk further than like 1,000 feet without needing to stop. And I knew something was like super wrong. So then again, that was a moment where I needed to advocate for myself. And I knew something could be potentially wrong involving endo that was causing my mobility. I went to a foot and ankle doctor. I got x-rays on my feet. I had an MRI. They found nothing. And that's when I knew that it was probably related to endo. So I had read about sciatic endo. And I thought, this sounds like maybe what it is. So I went back to my surgeon and I said, I think this is what I have. And she said, I don't know anything about that, but I know a doctor in Boston. And I had a consult with him. And he said, yeah, this does sound like it could be nerve involvement. So I traveled from Vermont to Boston in 2021. And I'm somebody who's still shielding right now from the pandemic. So to be going and being in hospitals in 2020 and 2021 was like terrifying.
Yeah, I'm sure.
So that just added to the whole thing. It turned out that I was right. There was a node of endo near my sacral nerve.
Wow.
That was getting, the doctor said, dangerously close to where he was able to excise it and he didn't have to like touch my nerve. But he was like, if this had grown and gotten worse, then I might have very well like lost my ability to walk because it would have been too painful.
Wow.
So just think about if I hadn't had the privilege, this is a big piece for me. If I hadn't had the privilege of the education that I have and the background that I have to be able to do that research on my own, I may never have even known to ask. And if I hadn't already practiced advocating for myself, would I have gotten to a place where I could have done that? I don't know. So I feel extremely lucky. And since then, I'm going to knock some wood. Things have been okay. Well, part of it is that now I have no ovaries because they just kept growing endometriomas. And I was like looking at a future of like every couple of years having surgery. That's just not sustainable in any way. So I made the choice, which was difficult because there's complications that come with it, to be in surgical menopause. And here I am. I think it was a good decision because I don't struggle with the same kind of level of things with endo anymore. Like I don't have a cycle anymore. And it was going through all of that really has led me to now where I don't just take one answer. If a doctor comes back to me with a particular answer and I feel like there's got to be more to it, I'll either like say something then, or I'll go back and do more research.
Right.
And try to find a doctor that will work with me where I am. Although I will say right now, I'm having a bit of like advocacy fatigue, if that's even a phrase. But like
Mm-hmm.
right now with masking like gone in healthcare, I have just not felt like I have the spoons to advocate for myself to go to some doctor's appointments that I need because I'm just kind of burned out on it.
Yeah, I think a lot of what you're saying is pretty relatable in terms of number one, advocating for yourself and having it be more of a dialogue between your doctor and yourself about what you found in research, what they suggest might be a better option for you. You did not settle for, I can't even say subpar care, but no care. You didn't settle for no care in the very beginning. And you were like, this is not how I want to live my life. And I deserve to feel relief and to feel better. And you never stop looking for answers. And I think that just goes to show the testament of advocacy and seeing how you took endo and then how you advocated for yourself in migraine land. And
Yeah.
that's not an easy feat. Both of these chronic illnesses are extremely invisible. You can't physically see. I mean, sure, we may be crouched over, laying on a heating pad and an ice pack on your head. Those things are visible, but you can't see the physical pain that is like happening and crumbling us on the inside. And the only way to deal with that is to get treatment and to get care and to be able to get back to a quote unquote normal part of life, or at least just where it's managed. And I'm knocking on wood right now for you, Katrina, because I am the same way. I feel like I have to knock on wood. I'm like to where you are at a place where it is doing better. It is, you're seeing bits and pieces of your past kind of come back and be like, okay, yeah, this is what life was kind of like where I wasn't in pain constantly. Okay. Like that's what it feels like to be able to read an email or have a conversation or have a thought without it being interrupted by constant pain. I feel like we don't talk enough about the ways we have pushed through and acted like we are fine when we are not. And I think
Yeah.
that's the biggest cosplayer for me is everyone with a chronic illness. I feel like we're all cosplaying as well, and we're not. We're not okay. We're unwell. And I just
Yeah.
appreciate all the advocacy that you did for yourself. And you advocating is not only helping yourself, it's helping the community. Just from what you have talked about in terms of you learn from the endometriosis community how to advocate, that was having a positive effect on you. And I know that if someone were to maybe hop into your DMs or ask you about their how to help or advocate, you're able to share this knowledge like with them in sharing your story with the podcast. And I feel like it's like an all like a circle of life, you know, in terms of coming around. And I do want to just make a note about advocacy burnout. Advocacy burnout is real. And I think we have to remember to care for ourselves and we have to remember to rest, and that sometimes it's okay to sit out until we get our battery recharged again. I'm a big advocate of talking about mental health. I live with anxiety, and just there have been times where I'm like, I know I need to go to the doctor right now, but I need to catch my breath first. And then, you know, next month I'll do it. So I know there's an urgency too. Like you said, there was something wrong with your body and you put it off and put it off. And it's anxiety inducing because you're like, I feel like something's wrong, but I can't handle with there being something wrong with me. So let me just like try and act like it's normal. I've been there. I've done
Yeah.
that. I pushed through an ovarian cyst rupturing when I was at work and I almost passed out in the bathroom. And then I walked out and I told my boss, I was just like, yeah, I'm just not feeling well. In that moment, I was like, why did I say that? Like, why didn't I say, hey, I am really not well. Like, I think something really bad happened. Oh, my appendix just burst. Obviously, that's not what happened, but an ovarian cyst is very painful. And I just feel like we do these things to survive. I guess it's a survival technique because you don't, on the
Yes.
job, you don't want to be seen as weak or whatever. But in those moments of me doing that, you putting, you know, being like, I can't handle it right now. I totally relate and can agree to that. I hope we can live in a society where things will change and seeking better health is a priority, not just for us, but as a society. Like we should be putting our health first. We shouldn't feel shame about having to go to the doctor or get a diagnosis. We should be accepted and be on a path to better treatment. And I think that's going to change the more we all advocate and the more that society learns like what it really is like to be a person that is chronically ill. real.
Yeah.
I appreciate, Katrina, you sharing your story, coming on the podcast. I'm hoping to keep seeing you fight the good fight and take breaks when you definitely need to and recharge that battery.
Yeah, I'm in a moment right now. I have so much medical admin that I keep pushing to the next week and the next week. And I think it's actually helping to have been on today for you to say that, to be like, you know what? It's okay. It'll get done when it gets done. And also, I'll just say I'm in an okay moment right now with my health. Like, I'm not great, but I'm also not where I was a couple years ago, dealing with both the migraine pain and the endo pain at the same time and just continuing to function somehow. I don't really know anymore how I did it. But yeah, just like you're saying, I definitely have been in those moments of pushing through. I have had a couple of ovarian cyst ruptures in my life. And that's, I think, one of the most painful things I've ever experienced. And I did a similar thing to you. I was at a volunteer gig and I stayed for a couple hours after I wasn't feeling well. I went home and it just continued to get so much worse that I knew that I had to go to the ER. But it's fascinating that the way that our society is that we're all just trained to push through and not take up space or not worry anybody or not to like wait until it's so bad to do something about it.
I know, it's sad.
For anyone listening, I'll just say it is okay. And if that ever happens to you where you just have a pain like that, just put yourself first. That's the thing to do.
Ugh, absolutely. Katrina, thank you for those, really powerful words of advice of please take care of you. Please prioritize yourself in whatever way you can. I know that it's easy for me to sit here and say go to the doctor and do all these things. Sometimes there are leaps and bounds that people have to do to get there, but I definitely appreciate when you can do those things. Thank you so much for coming on the podcast today, Katrina. It's been a pleasure.
Yeah, thank you so much for having me.
Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you have any questions, thoughts, or suggestions for us, you can send us an email at podcast@ghlf.org. If you like this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing with your friends and family. It'll help more people like you find us. I'm Sarah Shaw, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.